Hey guys, what's up? It's Paige. So I know it's been a little longer than usual between now and my last post, but I didn't really have a 9-month post-op update to do. I've said in several of my videos that I kind of just stopped having drastic changes happen from month to month. I think once you hit around 6-7 months, your scars don't dramatically change in appearance month to month. My treatment's been the same. I didn't really have any key messages like I did before about sun exposure or scar stretching or things like that I really had to talk about, so I just didn't make a video. Today is exactly 9.5 months post-op. It's more of a coincidence than anything because this video is less of a chest update and more of, I guess, advice around range of motion and scar widening and kind of the time frame for when you're able to have, full range of motion and do complete overhead and stretching like I just did. So right now I'm 9.5 months post-op. A little background into why I'm talking about this today is on Monday, last week, the end of last week, so about a week ago from today, I went to see the chiropractor, and that was the first time that I had been this year. I had surgery December last year, and last year I went to the chiropractor probably a little over a dozen times. I work a desk job. I've done a lot of different lifting and CrossFit over the years, and my shoulders and neck tend to cause me issues, so I'll go to the chiropractor to get aligned every couple weeks. But like I said, I haven't been this year up until last week was the first time that I went, purposely because I had surgery. I wanted to be careful about, to get adjusted, you lie on your stomach most of the time. So I want to be careful about putting that much pressure on my chest. When I sleep, I've never really slept on my stomach, so it's not something that I was doing. And again, I just wanted to be really conscious about having someone put a lot of pressure, because when they adjust you, they, put a lot of force to realign your bones. So I just wanted to make sure I was fully healed, and I didn't want to potentially stretch a scar or, affect the nipple grafts or anything. So anyway, this past week I went for the first time. I was having a lot of neck pain because I did some shoulder shrugs at the gym, which have always given me issue. I don't know why I did it, but it was a bad idea and it was just really in pain. So I went to the chiropractor. Anyway, one of the stretches that he suggested doing to help stretch out my lats and my back, because he said that's kind of where the issue was coming from, was to lift overhead and reach my elbow and go like this on, both sides. And when he told me to do that, I felt really uncomfortable because I didn't tell him I had surgery or anything. But purposely I was limiting all overhead motion, so putting my arm not just up, but up and all the way back. I mean, you can see the full stretch that's happening in this area, which is right where the scars are. Was very scary. So, but it was kind of one of those decisions, okay, would I rather be in this pain from my neck, which again is not related to surgery, it's just a chronic issue that I've had, and it really flared up from going to the gym. So would I rather kind of suffer through this pain for the next 2.5 months until I hit that 1-year point, which is my original plan of how long I was going to limit overhead reaching, or do I think I'm okay now to start doing a bit more stretching and reaching in order to alleviate this pain? So I obviously went with the latter. So as hesitant as I was, I did go ahead and do the stretching, and I've been doing it a few times this week, and it's really helped with my neck, which is good. And the good thing is that, being hyper conscious of my scars and how they're looking after doing that, I went and looked in the mirror and kind of saw, did my scars stretch? And they didn't. They looked exactly the same. They looked fine. So that was all really positive. From that experience, today, for the first time ever, I did physical therapy with the intent of kind of just loosening up some of the tissue and stuff, because when I did these range of motion exercises, it was really hard to get into that position, not just because I was scared, but my whole like shoulder and lat and kind of pec muscle area is just really tight because I've been limiting that range of motion. And I've read a number of things online to see, okay, when is it okay that your scars will stop stretching? When is it okay to make sure you're not gonna like permanently limit your range of motion from not moving? And there's a lot of mixed information. It's hard to find a really clear-cut answer, and it probably because there isn't one. Like, it depends on your age, it depends on your skin elasticity, it depends on how flexible you were before, how flexible you are now, things like that. But anyway, I thought this physical therapy would be a good idea. It's included in my insurance, so I didn't have to pay any extra, and it went really well. So the physical therapist was super nice. I didn't use the verbiage that I was trans, but I explained the surgery that I had, and the fact that I had horizontal scars running across my chest, and that I'd been purposely limiting my overhead range of motion for the past like 9.5 months, and that I just wanted to make sure that I wasn't permanently limiting that, and I just wanted to get full mobility back. So it was really good. She was super nice. We worked on some stretching. They basically just had me lie on a table, and she took my arm and put it in different positions and asked, if this hurt or kind of how I felt in this position, things like that. And it was really good. So she's obviously not a surgeon, but as a licensed professional physical therapist, she was saying that because I'm young and healthy, she would have thought that my scars were probably fully healed around like 5 or 6 months. So I've said in previous videos that I wanted to wait an entire year to kind of do that overhead stuff, but she said I probably would have been fine to start doing that like 3.5 months ago when I was 6 months. And just to hear that was like, it was such a weight off my shoulders. Like, it just felt this huge relief, like, oh my gosh, I don't have to think about this anymore. I can reach all the way up, I can stretch, I can do all this stuff, and it's not gonna adversely impact my scars. Again, she's not a surgeon, so I'm not saying that 100% what she said is truth, but I think she's credible enough in this area to be able to weigh in on this. So yeah, it was really good. I wasn't in any pain during our session. The session lasted like 40 minutes. And yeah, she said she would recommend going in like 2 or 3 more times. She said I had really good mobility as it was, but I guess I have what's called hypermobility. Might be a little bit off topic, but I have hypermobility, so meaning that like when I stretch my arms, I can actually hyperextend my elbows. So instead of going 180 degrees, they go a little bit further. So because I have hypermobility in my joints, she was saying that my range of motion is average right now. It's perfectly within that normal range. But because I'm hypermobile, my personal range of motion can go further than most people. So for me, because I can't stretch like what I'm used to stretching, she said that like for my body, my range of motion is not quite back to where it was. So by going to a couple more sessions, we can get it back to that level. So that whole story, the main point of this video is that the 1 year period of recovery, I would still say that if you want to do that, go for it. It's really what you feel comfortable with. Some of it straight up is just fear, like fear of stretching your scar by doing some kind of motion. And it's really scary. Like, even though she said I'm pretty much cleared to do whatever at this point, I'm still gonna wait to do like overhead lifting or pull-ups, things like that. But it was, I don't know, I just feel like mentally so much better right now, like knowing that I don't have to think as much about what I'm doing, that it might like aesthetically stretch a scar. So I would say if you're, based on what she said, if you're within the age of like 18, I think she said all the way up to 50, so pretty much like just an adult who's not a senior citizen, right? Like senior citizen being 55 and older, if you're kind of within that adult range, and you have decent skin elasticity, so a lot of you guys who bind, it might be a little bit different, but she said within like 5-6 months, your scars should pretty much be fully healed, and you can kind of just, you know, stretch, do range of motion stuff, and it is important to stretch within that first year because you don't want to have a condition known as like freezing, where your range of motion is permanently limited. So it is tricky. You do want to still listen to your body, go by feel, but I think, you know, if you have access to physical therapy or some kind of licensed professional in that same kind of field, whether it's I don't know if a general practitioner would be able to tell you, but just someone to kind of consult with, it's really nice and like affirming to hear that, because I think so much of my experience, and I would assume a lot of people out there, is just going on YouTube, doing independent research on Google, reading blogs, trying to, you know, get the most credible information you can. And because there isn't a cut and dry answer, it's difficult to know, like, am I doing this correctly? Should I have done this differently? So if you're able to go talk to someone, it's like mentally fantastic. It's good for your body, and yeah, it's just great. So that's pretty much the whole point of this video. The other thing she said, along with mobility, was she asked about any scar treatment I was doing. So I actually just showed her, but I was saying, I moved the camera so I have to like stand on my tippy toes. I was saying that, you know, I still wear the strips every day, and she was saying that I probably don't even have to do that anymore. The only reason that I personally am doing it, and I told this to her, was for the sun protection. So if I'm outside in a t-shirt and I have the strips on, it's a higher SPF than just wearing a t-shirt and no strips. So again, it's up to you. The strips obviously aren't free. If you're okay spending a little bit more, again, it's really just precautionary. I don't think beyond like 6 months or so, the strips are going to have much of an impact on the appearance of the scar, but for the sun exposure purpose, which would be like avoiding hyperpigmentation, I think wearing the strips is just a really easy way of protecting from the sun. And I've said this all before, like, if you want to wear sunscreen, that's great. It does require reapplication every 90 minutes. So from the time you wake up to go to bed, if you're wearing sunscreen, you're probably gonna have to reapply it like a dozen times or something. Strips, you just put on once and take them off when you go to bed. So yeah, that was my video. I'm planning on doing a 10-month in like 2 weeks when that comes up. I'm also planning on putting out a couple videos on pre-op preparation, so like supplies, things you might want to kind of orient in your house ahead of time, because I didn't really talk about that before, as well as, I don't know, just like general post-op care, like kind of my experience with when I stopped sleeping on my back, things like that. I'm coming up on 1 year, not too far from now, so I'm kind of just been doing a lot of reflecting on my whole post-op experience, and there's I would assume is one of my followers or someone I know who watches my videos. They're having top surgery in just a few weeks, or like sometime beginning of October with Garramone, and they're also non-binary, not on hormones, so I kind of have them in mind with some of these topics that might be useful to them, and then obviously might be useful to other people. So if you have any questions or other topic suggestions, I will gladly take them. But yeah, that's it. So I'm 9.5 months post-op. That's a video all about range of motion. Sorry if I spoke a little quickly. But yeah, that's it. So have a good weekend.